Hello friends, my name is Dr. Ashok Vaid. I'm a medical oncologist. I work at the Medanta Cancer Institute, Medanta the Medicity Gurugram. There is a huge connection between how we live, what we eat, what we use, and the type of diseases we would suffer. And our lifestyle has a significant role to play. There are certain lifestyle choices, out of which tobacco is number one, which has the maximum negative impact on the health of an individual. Apart from cancer, we know that lung diseases, heart diseases, peripheral vascular diseases, many other diseases are directly associated with tobacco. Talking of cancer, there are at least about 1.5 dozen cancers, 15 to 18 cancers which have direct relationship with tobacco, out of which head and neck, mouth, voice box, lung, food pipe, many others are associated with tobacco. Talking of the numbers, about 30 to 40% of the cancers are directly linked to tobacco, which goes to say that if today we ban the use of tobacco or everybody shuns tobacco, over the next 20-30 years, 30% of these cancers would be gone away. That's one lifestyle. The second lifestyle is sedentary lifestyle and being obese, being overweight, not being physically active. Now that contributes to almost about 20 to 30% more. So friends, one can realize that 30% of the cancers have direct relationship with the tobacco, and another about 20 to 30% have relationship with your body weight, your body mass index, and your activity level. So 50% of the cancers are associated with two lifestyles. The other lifestyles associated these are modifiable. One can control the weight, one can control the diet, one can exercise. The non-modifiable, we just cannot change. The genes with which one is born, you can't change that. The environment you are living in, you cannot change. So these are the non-modifiable factors, and they contribute about 5 to 10% of the cancers. Lot of cancers, this is a question we are asked in the clinic: Doc, why did it happen to me? What wrong did I do? Lot of patients may not have an identifiable risk factor. However, these may be just sporadic. They may be just by chance. But the other factors which need to be kept in mind are poor intake of fruits and vegetables. They are protective. Once they go into the stomach, all those cancer-causing chemicals, especially the nitrites which are produced on account of other foods like smoked foods, foods which are pickled, which are heavily salted, they release toxins in the stomach. Fruits and vegetables neutralize those toxins. People who are using ultra-refined foods which are packed for long preservation, they lose their nutrition value. They bring in other side effects. These are the foods which are bad. Don't take sugary drinks, too much of carbonated sugary drinks. They're all adding energy, calories to your diet. One may not realize that on a day-to-day basis. Exercise. All the cancers, as I said, tobacco has a clear connection, and the tumors I listed before. Obesity I talked about, cancer of the uterus, cancer of the colon, prostate, many other cancers, even kidney cancers are associated with being overweight and being sedentary. And the list is long.